Welcome to Team 5's presentation on IT-enabled transformation plan for Barlow Respiratory Hospital. The American Hospital Association acknowledged that the over 65 population will triple between 1980 and 2030, with the first baby boomers turn 65 in 2011. Although the health and lifestyle of people at age 65 is very different than it was in generations past, it's even been said that 60 is the new 50, the reality remains that chronic conditions continue to plague the population. In fact, the American Hospital Association reported that more than 37 million boomers will be managing more than one chronic condition by 2030, with 1 out of 4, or 40 million, living with diabetes. Almost half will be living with arthritis, and more than 1/3, or over 21 million, will be classified as obese and living with all the health risks associated with obesity. Healthcare and hospital care spending keeps growing. In fact, national healthcare expenditure per capita is over $8,900, while Americans are growing less and less healthy. Hospitals across the country are looking at ways to become more efficient and reduce healthcare expenditures while providing more accurate diagnostics and knowledge-based treatments. Pestle analysis of the healthcare industry reveals that, overall, the healthcare industry is very robust and shows that there are more positive impacts on the industry than negative. The most significant positive factors of the healthcare industry in 2015 are political, from the Affordable Care Act, and demographic, with aging baby boomers. Technological advancements also have a positive impact on the healthcare industry and looks promising into the future as innovations, such as electronic medical records, continue to save on costs and improve the efficiency of the healthcare workplace. According to Porter's 5 Forces analysis, the healthcare industry is a very attractive industry. As shown in our table below, its combination of high barriers to entry, low bargaining power of buyers and low threat from substitute products and services combined with the medium level of rivalry makes it an oligopolistic environment where hospitals and other healthcare providers and suppliers enjoy a high degree of success. This is the existing business model canvas for Barlow Respiratory Hospital. It depicts key partners, activities, and value propositions, as well as customers' relationships, segments, cost structure and revenue stream. Barlow Respiratory Hospital's reputation and proven track record for weaning patients from respirators is its greatest strength. Its only weaknesses are in its ability to improve upon its infrastructure to care for more patients. Barlow has the potential to increase patient throughput and continue its services to larger numbers of people. As Barlow continues to use technology to improve patient care and organizational efficiency, it will benefit from improvements in information management and use of data science. Barlow has competition from 2 larger acute care health organizations, and only its resilience in maintaining the highest quality care and continuing to improve upon current positive patient outcomes will it be able to sustain its strong reputation. The hospital industry functions through many interactions with several other healthcare industry participants. According to the Wharton School study of the healthcare value chain, the 5 major entities involved in the value chain are the buyers are the payers and the intermediaries; the provider, which is the hospital; the supplier, the purchasers and producers of medical equipment, drugs, etc. For over 110 years, Barlow Respiratory Hospital has been relying on its valuable value chain system and experience to serve the Southern California community. It has evolved into a private, not-for-profit, 105-bed, long-term acute care hospital with a wide-ranging and distinguished history of providing respiratory and specialty medical care services to Greater Los Angeles and the surrounding Southern California region. Barlow Respiratory Hospitals is process for admitting and caring for new acute care long-term patients includes 6 entities that work through processes to admit, evaluate, medicate, test, and provide care for a patient. Before the patient is admitted to the hospital, the admitting department, upon receipt of an external referral, makes the decision of whether the patient is eligible or not. If not, this ends the as-is process. If yes, the patient is then assigned a doctor that evaluates the patient, orders lab tests, and prescribes medications. The nursing department administers the medication, and after the laboratory completes its orders, the patient is sent to the respiratory department where the TIPS protocol is used for weaning patients from ventilators, or respiratory care is given. The patient's doctor decides when the patient will be discharged and the patient leaves the hospital to go home or to a nursing facility. All the while, the patient's electronic medical record is updated by each department and stored in the hospital's data warehouse. Our new process keeps the current process as is, but will add new Internet of Things monitoring devices to patients as they leave the hospital. Patients will be trained on how properly use their at-home devices. Information from the home monitoring devices will be collected in the form of structured data and unstructured data. This new process also adds infrastructure in the form of a Hadoop cluster, where predictive analytics will be used within the information that is fed to the remote patient dashboard. The new technology allows for doctors to assess patients' conditions remotely while the patient is at home. The use of predictive analytics to find trends in existing data will benefit current and future patients. Every morning the patient will be answering some questionnaires on a tablet or PC to acquire some physical and mental condition of a patient where the Internet of Things sensors won't capture. The data from the questionnaires together with the data from the sensors are uploaded directly to the patient account. These data will also be uploaded to Cloudera system where it can be analyzed for insights and patterns about the patient health. Using predictive and prescriptive analytics via machine learning applications, doctors can predict the future condition of the patient and can act accordingly to prevent any preventable illness. Barlow can call patients and advise to come in for further diagnosis, or they can also send a health worker to ensure wellness of the patient. A patient health dashboard will be utilized as a tool to make data-driven decisions to improve patient outcomes. Shown here is a small representation of how data is being transmitted to the remote hospital site for further analysis. In summary, home-based monitoring of patient vitals via medical device interoperability will improve patient care as well as care outcomes in the long run. Combining this with patient engagement tools such as portals will not only improve care monitoring and delivery but also increase patient engagement and affinity to the hospital network. Benefits of the iHealth transformation will be realized by Barlow Respiratory Hospital through several reduced costs, to include costly transports and unnecessary hospital visits thanks to the remote monitoring devices. Trips to the hospital will be circumvented as information will be reported directly to the doctor. Hospital staffing decisions will be made with increased knowledge that will lead to lower human resource costs. And malpractice lawsuits and insurance costs will be decreased as better useful information is transmitted concisely to all pertinent parties. The working environment within Barlow Respiratory Hospital will be improved with the consolidated dashboard information by increasing the healthcare team's productivity, empowering medical staff to discuss what they see together about the patient and assist the doctor through enhanced collaboration. Doctors will realize improved efficiency and expediency by gaining insight to their patients' vital health information, aggregated over time, and transformed to useful information based off of trends found within the remotely monitored data. Finally, patient satisfaction will be realized as increased quality of life ensues from being better informed. Chronic and permanent illnesses can be treated better with a consistent stream of large amounts of data that provides information for the customization of real-time treatments derived from prescriptive analytics. The following video presentation from TILIS Health invites you to see a patient's perspective on the usefulness and value of home health monitoring. iHealth proposes to use similar technology and devices coupled with data science and analytics.
I've been diagnosed with pulmonary fibrosis, which is a disease of the lungs that is incurable. It does cause a lot of difficulty in just everyday life, because when you're moving around, you just don't have enough oxygen to do very much. It's just total restriction of life. The technology that has been created through TELUS has made my life better. It's a small computer that is connected to the hospital. So in the morning when I get up, there's questions that are asked about my condition. Then it's sent off to the hospital where the nurse is stationed. And they know right away when they get my information what health I'm in today, if it's stable or if it's not stable. And if it shows that I am not stable, they will contact me within an hour of my information getting into them. I feel more secure with this here because I know that I'm being monitored 24 hours a day. I think it's a great piece of technology.
The balanced scorecard is targeting an annual decrease of patients' care cost of 10% per capita with the new enabled electronic monitoring system. Furthermore, our new knowledge-based decision-making processes and team-oriented collaborative culture should allow for a 95% employee satisfaction. At last, we aim to keep our patients satisfied and provide them with more avenues to interact with their physicians and more control over their condition and health, which helps reduce anxiety and allow them to be happier. This was a presentation of Team 5 with James, Jason, and Axel. Thank you for watching. Any questions?